Fortified City TV presents Health Matters. We bring you education and awareness on your health, the total person, your spiritual health, your physical health, and your financial health. Please join us, faith leaders, professionals, and community leaders, this Thursday and every Thursday at 6 p.m. CST or 11 p.m. GMT for a life-changing encounter. Your health matters.
This place right now. Believe it. Believe it. Believe it. Believe it. Hello and welcome to another edition of Health Matters. I am your presenter and host, Pastor Patience from the Fortified City International Ministries. And as always, we have some wonderful, and we are blessed also to have some contributors, regular contributors to this program. And we have with us again tonight, Abby Tyler. So the doctor is going to be telling us all about eye health today. So Abby, I want to say welcome.
Thank you. Thanks for having me.
It's always good, to have you on this platform. And to you out there, we want to say welcome to the program. And do us a favor, share the video, and you can make your comments and send a suggestion or question, whatever it is. The text boxes over there, do what you can do. So I want to say thank you for joining us. And it is always a pleasure to bring all this information right at your doorsteps. So tonight is eye health. I really want to know because, sometimes you go to the doctor and you don't want to tell them everything or ask them all the questions. But I have Abby here tonight. And myself, I'm wearing glasses. This is a serious glasses here. I have to use these glasses to read. So I need to know. I need to know everything. I need to know about eye health. So, Abby, what does it mean when they say, your eye is healthy?
Okay, first, thanks for having me here. Let me introduce myself. My name is Abby Tyler. I'm a practicing family nurse practitioner. I'm also a health contributor to different shows like this one, and I'm also a community health volunteer. My quick disclaimer, I am a provider, but I'm not your provider. So whatever we say here should not take the place of you checking with your doctor. So do not change your regimen before doing that. So let's start on that. So we'll be talking about eye health today. So we'll talk about what is healthy eyes. So start first, another disclaimer. I'm also not an optometrist or an ophthalmologist, but I send my patients to there, and we have to have some idea and information and knowledge about eye health as well when we're primary care provider. Okay, so let's start. Healthy eyes. Let me just read this. Healthy eyes and good visions are important for your quality of life. But even though you may think that you are seeing your best and your eyes do not have a noticeable symptom of any diseases, they may not be as healthy as they could be. Having an annual eye exam is the best way to protect your eye. There are other steps you can take to prevent common eye and vision problems too. So basically, healthy eyes are those people who go to the eye doctor to get the eyes checked at least once a year, or if you have issues, your eye doctor will tell you how often they want you to come back.
That's great. That's great. So you see, it's good to have your eyes checked at least once in a while. She is going to tell us everything we need to know. So let's start with some of the factors, Abby. Some of the factors that affect the eye or eye health.
Some of the factors that affect your eyes, one would be important will be proper nutrition. Your eyes rely on certain vitamins and nutrients to protect them against all the different blinding diseases, such as macular degeneration is when you start losing the vision in the middle of your eyes, and glaucoma. Those are diseases that come on later on. So it's very important that you having you're having complete diet. You get all your vitamins in your diet, eating healthy, eating food, seafood, cut back on the red meat, and all those different things. Protect your blood pressure and all those different things. So like carrots and stuff like that is good for your eye health. Green leafy vegetables. So you want to make sure that you're getting proper nutrition.
Sorry.
Okay.
Go
Okay.
ahead, Abby.
All right, and the other one would be exposure. Your eyes, when you're out there in the sun, they tell you to wear sunglasses that have ultraviolet protection. Usually, if you buy your sunshades, it should say on there. It doesn't have to be expensive. Also, when you're wearing regular glasses, so you want to tell they have transitions to where when you go outside, your glasses turn into sunshades, or you can have glasses that have protected ultraviolet protected too. Or you can wear the one covering your eyes when you go out there because it's very important to protect your eyes from the direct sun. So do that. And also for toxic chemicals, you don't want to be in places where there's people smoking and other different things. All those things have effect on your eyes. I went back to smoking also. So tobacco can also decrease your the strength of your eyes as well. So it's important to stop smoking if you do smoke and don't be in places where people smoke because that also affects the eyes, especially for little kids when they're growing up too. The people and they grow up in a house where the parents smoke, other people smoke around them. That's if you have kids, if you smoke, try to quit smoking, okay? Or if you have to smoke, smoke outside so you're not smoking directly to where your child is exposed to it. And other health conditions that affect the eyes, again, I always say diabetes, type 2 diabetes. Type 1 diabetes is the one you get when you're very younger and you don't have the beta cells and all that. So the thing that's supposed to work with you to produce the insulin to keep you healthy, you don't have that. So when you're young, eventually that would also affect your eyes too. Type 2 diabetes is the number one cause of adult blindness. It's the one you get later on in life. So you want to make sure that you go to your family doctor every year and you're getting your blood work checked, your A1C. I'm going to do a video on diabetes before later on this year. So getting your A1C check, making sure you're eating healthy. So eating again, less red meat and all those different things, exercising every day. So when your body is healthy, it also affects your eyes. So your healthy body, healthy eyes. Okay. And also trauma, making sure you protect your eyes. People like play with different things, firecrackers, fireworks, and all that. Keep your eyes away from that. And any kind of trauma, infection. I would tell people make sure that if you think there's anything going on your eyes, go and get it checked. Do not share eye makeup with anybody else. I don't care how close you are to that person. If you have to share eye makeup, making sure, yeah, you can use your own brush or don't do it anyways. I would tell you don't do it. And even for yourself, if you're doing eye makeup, your brushes, make sure you're washing them at least once a week. And they tell you to also try to get rid of your makeup at least every 3 months. So it's best that you don't get expensive makeup. So that way, if you have to throw it out, or if you're washing your brushes, that should be okay. But if you notice anything's going on your eyes, if it's reddened and it's draining and all, sometimes it could just be seasonal allergies, but you want to get checked because any little thing, something that could be very minor, could affect your sight. So you want to go get that checked. Okay, and there's the other non-modifiable self care. Those things modifiable, so you can change those things. You can help on that. Non-modifiables or family history. There are certain diseases that run eye diseases that run in families that you don't have any control over. But if you go in to get your eyes checked every year and you tell your eye doctor about your medical history and all that, your vision history from your family, they can do as much as possible to make sure you delay the onset of that disease or prevent it as much as possible. There's so many advancements in all these prevention now, so you don't necessarily have to suffer the same fate as a family member.
Okay. Okay. Um, um, that's a family history.
Yes, we did the family history and then
Yeah.
also go on there. Okay.
So why is it? I know you went over it a little bit, but I want to ask the question again. Why is it we must have an eye exam? Why is
Okay.
it necessary?
Now it's important to have it's necessary to have it because you can say, okay, I'm fine, I can see, okay, but there's some other diseases that have nothing to do with vision that it can be detected through your eye and test as well. Let's say things like multiple sclerosis. I talked about that where it's like your body sends the message to your brain and tells your hands and your feet and everything to move around. Eventually, when you start having diseases like that, it starts thinning and you're not getting the message to your brain. Your body starts deteriorating. Sometimes they can find that when your eye doctor is doing the test, they can find that even through your eyes. So there's so many other things that can be found out through your eyes and stuff that you may not otherwise know until it's too late. Now, I'm not saying that, there are not other tests that can pick up certain diseases, but your eye, like again, your eyes are the windows to your soul. So it's important to do
Mhm.
that. All right. And then also you want to touch your visual acuity, meaning that, okay, let's see how well you can see when you go to the doctor's office. They have the test where they have all the numbers and letters on the board. You want to make sure that, you want 20/20 vision or as close to 20/20 vision as possible. So if the child may be complaining of something and headaches and stuff like that, you take them to the doctor's office and say, okay, maybe they're not seeing that well. Maybe it could be that. You could be thinking it's just headache, but it could be the fact that it's straining the eyes. So it's important that they go and make sure that you can see completely and you can see effectively to be able to function really in life. All right. And the next one, check for your eyeglasses. So you may be wearing eyeglasses already. And some people, when I ask my patients, I say, when's the last time you got your eyes checked? Oh, I haven't gone for 3 to 4 years. You're supposed to be going every year
Every
so
year.
they can make sure that your prescription, you have the right prescription. And also sometimes you may have gone to another eye doctor that it maybe overcorrected it too much and it's a little difficult and you've been going through, you say, oh my God, there's something with the glasses. I can't see too clearly. But anyways, I guess the doctor knows what they were doing. And not necessarily the doctor made a mistake, but maybe at that time you needed those strong prescription, but over time you may not have needed it, or maybe it wasn't corrected the right way and they need to check your lenses again. And you're just the fact that you're getting older, you may need your stronger prescription, so you want to go every year. All right. And also for children, I went back to the children. A child could be in school and misbehaving, and you're thinking, oh my God, or the child, you taught them to study and they're saying, I can't understand this, or seeing the words backwards, letters backwards, like dyslexia and other developmental diseases. So you want to, you see that, you say, okay, let me go get my child to get an eyes check. So from there, as young as 6 months, they can start getting the eyes check. So you can go ahead and start doing that, so you won't prevent all of that, because you don't want that child growing up and thinking, oh, I'm just stupid or I'm just dumb. And in certain societies where you don't have all these different amenities and different factors that can help people, so it's important that they go early to get the eyes check and do keep doing that and come back. If the doctor tells you, come back and get your eyes checked maybe every 6 months, go back there and make sure, so prevent your child from going through all their torment in school, getting teased and bullied and all that, because they're thinking they're so dumb they can't understand certain things, when it's just something as simple as an eye test that can remedy that situation.
Wow, this is serious.
That's
So
it.
when things happen, they go to check, check, do a thorough check, and just not conclude that this is where the problem is.
And
That's
most of
always
the time
good.
too, when the kids are younger, like they come to go to the pediatrician, and even when you come to your family doctor too, we do your examination. We look at your eyes, and sometimes
Yeah.
we will see things and then send you to the eye doctor. But the little one that we do at the doctor's office, your primary care doctor's office, or the pediatrician office, is not the total eye care. You need to go to the eye doctor so they can do all the different stuff that they do to make sure to dilate your eyes and do everything, make sure to look on behind it. So that's why it's important to, in addition to going to your family doctor, you need to go to your eye doctor too.
Okay. Can you tell us some of the eye conditions, like some of those uh maybe
Some
diseases that affect the eyes?
Some of the conditions that, like I say, can be easily managed by just changing some of your prescriptions and definitely like nearsighted. Some people, like when everybody in my family wears glasses, I was the one, the last one to start wearing glasses. But it's like when you're looking at something and you have to be putting your information like that and you can't see it, because my son
Mm-hmm.
used to take the paper and put it right in my face and like, okay, I can't see, I need to move that. Or I'm driving at night and I can't see the stop sign, but I can see things close to me. So nearsightedness, farsightedness, and also you want to make sure you get that checked. So because you may need glasses, you may need bifocals, and they have really beautiful glasses right now. So a lot of people might say, oh, I don't want to wear glasses, it'll make me look old. They have so many pretty ones that you can wear now, and other ones where like the eye astigmatism, where like the eyes kind of inside, you can see as you move in the light kind of blinking back and forth and see like it coming out. So all those different diseases can be easily corrected. Even sometimes strabismus, where the people with the eyes, like they're supposed to look at, when you put something right here, they're both supposed to look at the eye, like, so I have my finger here, they're
Yeah.
supposed to look at that. But sometimes they're like one's going this way, one's going that way. So that can also cause vision problem, and eventually some of these can lead to, like, blindness if they're not taken care of. So it's important that you do that, especially when the child is younger. You want to see that. And even when you look at pictures, sometimes you can see the child looking different way, cross eye, like we used to call it before. They used to cover
Yeah.
one eye and do those different things. But they have different ways of working with that now. But it's important. So don't just say, okay, my child has crossed eyes. There's nothing I can do about it. There's so many ways that they can fix that now. Okay. And we go back, other things that affect the eye to and related macular degeneration. Like I said, before you know it, you stop, you can't see on the sides of your eyes. You can only see right in the middle. The person be like, oh, I can't look. I can't see if I'm driving and cars coming this way. I can't see. I start losing my vision, my peripheral vision from this side. Glaucoma also, that comes with the blood pressure. If your blood pressure is not controlled, that also affects the pressure of your eyes. That's very, very, very important to get that checked. Make sure your blood pressure is checked all the time. And also the most important one, like any kind of eye emergency, if you ever do anything and you hurt your eye and you have any problem seeing, please directly go to the emergency room. And also, if you were somewhere and your eye, you just feel like I said that the retina detachment is like a curtain just kind of pulled right over your eye, like you just
Mhm.
sitting there and it just like get to the emergency room as fast as possible to make sure, because that alone can lead to blindness if you don't get help as soon as possible.
Wow. And if you don't want glasses, it's possible they could use contact lenses too, right?
Yes, you can do contact lenses, but then again, that also depends on your full medical history also.
Mhm.
And then some people, like you have dry eyes. If you have very dry eyes, the contact lenses can be very, very irritating to that. So you and your doctor would make the right decision that's best for you. They have so many now contact lenses now. Like I said, everything is so advanced, so you and doctor can make that decision. I wanted to do contact lenses too, but I'm too skeevy about putting that stuff in my eye. So I
Mhm.
said no, I would just wear glasses for now. But yes, and they also had LASIK surgery too, so
Yeah,
you don't
the laser.
necessarily have to wear glasses. But all those, anything that they do, anything come with risk too, especially like LASIK surgery. But it's so advanced also, so your risk is low. But again, it's the we still have to notify you that when you're doing certain things that it comes with risk too, because it's a surgical procedure.
Hmm. Is there any other eye condition that we need to know about?
I mean, I went over the main ones. Oh, the ones I diabetic retinopathy. That's the one that if you have diabetes is not controlled. Again, like I said, diabetes is like the leading one, the leading causes of adult blindness. So when your blood sugar is not controlled, the little blood vessels in your eyes and all that, that starts kind of thinning away, and you start losing your eyesight. And in this world, if your sight is important to you, especially you're a working parent, or even you just regular person, just it's just your freedom. So you want to make sure you do that. That's why it's important to make sure that if you're diabetic, you want to prevent getting diabetes. And if you're diabetic, you want to make sure you keep your A1C under control. You want to make sure you keep that. So if you put your medication, you have to take your medication. I know I'm studying to take medications, especially if you're already on insulin, but it's really important because with diabetes comes with so many other issues. But since we're talking about eyes today, at
Yes.
least you want to make sure you maintain your sight, because you can take care of everything else, but you want to maintain your sight because that's basically your freedom right there.
Yeah. Yeah. It gives you the freedom to move all over the place with all guy. Yeah.
Yes, and like a dry eyes too. I one of those people. I have dry eyes, so some people just have really dry eyes, and I have dry eyes. And sometimes I used to be driving, and my eyes would be so dry, and it like almost feel like it's peeling. So I always have my eye drops. I have one in the morning that I use in the morning, and then I always have my other. Well, I have one in my bag, so in case if my eyes get dry during the day. But once I put my eye drops in, and if you have to put your eye drops in, you want to make sure that the tip of the eye drop bottle is not touching your eyelid, because you don't want
Yeah.
it just in case if infected. Do not share your eye drops with anybody. And you pull down your eyelid and just drop it right in there, and then squeeze your eyes together so the drops kind of spread through there. If you have to do it for a child, they can turn their face. And you put the eye drops right in the corner of their eyes, and then it just kind of goes in there. You just have to blink a couple of times and all that. But do not share your eye drops, and do not let your eye drops touch your
Yeah.
eyes touch the tip of the bottle. And also
So,
pink, yeah, pink eye, of
mhm.
course, that's highly contagious as well.
Oh
People
yes.
that. So we still call it back home Apollo, something like
Yeah,
that.
yeah. We used to say Apollo.
Yeah, so it's highly contagious. So if you get that, stay away from everybody.
Hmm.
Do as much as you can. Clean every surfaces, wash your hands and all that. And if it's in one eye, it's gonna go to the other eye. Call your eye doctor. We have eye drops that we can do until you can go back to school or go back to work until that's cleared.
So, can you give us some tips to maintain the eye health?
Okay, so we're gonna go some of the tips. Okay, again, like I said, make sure you enjoy a diet rich in fruits and vegetables because that's the fiber. It will keep your blood pressure down. Eat a lot of carrots, green leafy foods, like your potato greens and your cassava leaf. But we cook everything completely, so
Yeah.
sometimes we take the nutrients out. So every once in a while, have some salad and things like that. Eat a lot of seafood, like a lot of fish. Cut back on the red meat, salmon, tuna, halibut, all those different things, blackberries. If you have to take any medication, because they have the seafood has like omega-3 fatty acids, and it cuts back on your cholesterol. So that's important for you to eat a healthy diet every time. Eat don't eat late at night too, because the cholesterol. So once your body's healthy, your eyes will be healthy as well. Again, wear sunglasses that's going to protect your eyes when you're out there. Maintain a healthy weight, or lose, if you're unhealthy, lose the unhealthy weight. I'm not saying for you to be out there and be all skinny mini. If you're skinny mini, that's good, but just stay healthy for your body. Stay, like you say, stay healthy for your body frame. Okay.
Mhm.
When they tell you, I talked about the BMI scale, go tell your doctor, say, okay, I'm supposed to be this tall, and I weigh this much, so I'm supposed to weigh this much in the BMI scale. Talk to your doctor about that. Make sure you're healthy, and as much as you can. Nobody's asking you to do over and above, but do as much as you can to stay healthy. Get a recommended amount of daily exercise. Again, 30 minutes a day, 3 times a week or more. If you can do more, go ahead and do that. You don't necessarily have to go to the gym. You can have a brisk walk every day in your neighborhood. You can go jogging. You can dance heavy, as long as you're, putting your heart into rhythm and all, and staying there and doing that more often. Don't just say, oh, I walk to my job or I walk to my school. Your body gets used to doing that. So your body's not working any harder than that. So try to do a little bit more. Park far from your job, take the stairs instead of the elevator. I also said use protective eye. If you do any kind of job that you need to cover your eyes with goggles, make sure you're doing that so you don't splash anything in your eye. If anything splashes in your eye, making sure you follow the manufacturers, whatever it was, wash your eye out completely, flush it out, flush it out, flush it out, flush it out. Okay. And clean dirty contacts, making sure you follow what you're supposed to be doing to keep it clean. Do not share makeup. The same thing with, don't put the eye drop bottle closer to your eyelids. Do not share makeup. Do not share makeup. And if you do get an eye infection, take all your makeup stuff and everything, throw it out, or get all your brushes and all, put them in hot water, let it boil nicely, and take the pot off the stove first, and then put it in the hot water, and make sure it sterilizes. Okay, I say fire every once in a while. I'll tell my husband, I'll be like, I'll put that thing on the fire. Then he teases me. He say, "Oh Lord Jesus Christ, you don't say fire anymore. You usually use a copa now." So I just gonna say stove. I said, well, I know you know what I mean. I've been stoves. So you do that. And then also, most important thing, we're in the age now where we sit there and we watch TV all day, or you got your phone close to you because you need that, or the computer. So it's very important that you don't have the phone this close to you. You don't have the computer right in your face watching TV. Try not to keep your eye on it all the time. Okay, take a break. I always tell my son and the younger ones, because they're growing up when we were younger, we didn't have all of that. The TV was one TV. We didn't have the phone. We didn't have computer, everything in our faces, but they're
Mhm.
growing up in that world. So it's very important that they protect their eyes. So the thing I talked about is the 20-20-20 rule. For every 20 minutes, you want to look away for 20 seconds, all the way for 20 feet. Okay. So every 20 minutes, look away from what you're doing, look away 20 feet for 20 seconds, and then go back to what you're doing. If it's possible, do that more often, or increase the time you're doing that. Tell yourself, I'm going to be in this phone, especially like things like TikTok. You sit on there, and before you know it, 3 hours later, you've been staring at that screen for a while. And then before you start saying, you start
Yeah.
you have headaches. So it's so easy to get hooked on there, or watching something crazy on Facebook, or just normally doing work on your computer. It's important that you take time to look away from there and talk to your doctor. If you start experiencing headaches, they have different protective thing that you can put on your computer that can kind of block the blue lights that comes from the computer that can cause headaches and also pain to your eyes.
I was just about to ask that question when you started talking about the screen. I wanted to ask about, what's the recommendation for those that stay long hours on the computer or maybe on the laptop? And then, is there any apart from this exercise, the 20 20-second exercise, is there any other exercise for the eye?
I mean, not particularly, but just to make sure that if you're supposed to use the eye drops, you use your eye drops. If you have dry eyes too, I also talked about eye
Mhm.
ointment. Your doctor go speak to your doctor first. You can do the ointment at night that will keep your eyes moisturized. I know some people are like, oh my God, I don't want to put ointment in my eyes. It won't look sexy when I'm laying there next to my husband or next to my girlfriend or next to, but your girlfriend doesn't want to have you blind either. So, so do that. And the most important thing is just doing things that will protect your eyes, knowing
Yeah.
about your family history, knowing about your family medical history, and sit down, talk to your families, and say, okay, if there's anything that runs in the family, some eye diseases also kind of skip generation, so it
Mm.
may come to your generation. So you want to,
My goodness, that kind of inheritance is not
yeah.
good.
So it'd be like, and it's like just ask them. But we come from a culture too that people don't talk about their history that much
Yes,
either.
exactly. Yeah.
So we just have to get to the point where we're open enough to have these conversations. So I mean, it's like, you're my aunt, you're my uncle, you're my grandfather, and this and this. I don't want to be into your business, but I just need to know more about our history because I want to be able to protect myself and also protect my family. And most important thing is diabetes. If try to prevent diabetes as much as possible, or if you do have it, try to control it as much as possible. It's that important.
Thank you. If you're just joining us today, we are talking about eye health, and we don't have much time here right now. We're going to be done in the next 4 minutes. So, thank you for joining us. Just continue with us until we end. Abby, she want to conclude on the eye health.
Okay, so and bottom line, like I said, eat healthy, watch your numbers, watch your blood pressure, especially knowing when to go to the hospital for any kind of major thing, any kind of eye emergency. I last time I was talking about it. I splashed the hand sanitizer. Please make sure that it's not close to your eye level because when
Mm.
that is like pure alcohol, when it goes into your eyes, it hurts like the one of the worst things you ever experienced before. And I had that done to me twice already.
Oh
So
my
please
goodness.
try to make sure, yes, try to make sure that it's not eye level. Okay. So when you're doing that, put your eye completely away from it so it's not close to the eye, especially because, God forbid that happens to a little kid or something like that. You want to keep that away. So sometimes like you go through your entire life that nothing will ever happen to your eyes. And people from the they're the little to the day they get to they you never have to you never have to wear glasses or do anything with their eyes. Some people aren't that lucky, just like how some people get other diseases and other people won't get it. And doesn't mean when you start wearing glasses that you're uncool or you did something to your eyes. You just need to get your eyes checked again, like I said. They may find other diseases, and God forbid, knock on wood, they won't find anything else. But you want to go show and you get your stuff at early as age 6 months. Go ahead and get it. If your kids are going back to school now, if they're complaining of headaches, if they're saying I can't see the board, and their teacher saying, well, they're not paying attention because they're this and this, and they can't see the board, they have to sit up front so they can see the board better. That's one of the signs that you want to take your child to the eye doctor to get your eyes checked. Okay.
Okay. Thank you so much, Abby. And we want to say thank you to our viewers out there. It was good having you again with us tonight on Eye Health. And we will be back here next week, Thursday, same time on Health Matters. Abby, we want to say thank you. Is there any other thing you want to say before we close?
No, I just want to say thank you for having me. And this is a collaboration between Abby Tyler's Healthy Living and Pastor
For the
Patient.
Diabetic.
So, you can go. I do post some other things on my forum too. So you guys can just meet me over there every once in a while. And I love contributing because we're all in this together. Like I tell people, they think that's so you support me, I
That's
support you.
true. It's
Uh,
so true.
we all this village together. So,
Yeah.
we're different. And
Yeah.
at the bottom line is you're providing the services that people need. I provide the services that people need, and we all looking out for each other. It's all a big community.
Thank you so much. We appreciate you very, very much. And thank you. Like we said earlier, this is just for information and education purpose. Always make sure to see your primary doctor. For those of you out there that are sick, whatever the case may be, we believe that God is the healer, the doctor treat. So by his stripes you are healed. Continue praying, continue believing God, and we say it is well. There is nothing, absolutely nothing impossible with God. So God bless you tonight. We will be back in the next 15 minutes. There's a program coming up on 45 City TV. It's called It is possible. Got a 5 days program going on beginning today. So whatever it's that is in your life, whatever the condition, the possibility for change is there. With God, all things are possible. God bless you and thank you for joining us. Thank you again, Abby. We'd love to have you again another time on Health Matters. God bless you.